She is Susana Lopes, and she's Secretary-General of the Prenatal Alliance. She's president of the Norwegian Association for Prenatal Education. She's a dedicated prenatal educator. She's a yoga teacher, an author, and speaker. She has some 20 years of experience, and she empowers expecting mothers to enhance their health, manage stress, and connect deeply with their babies. A mother of three, author of Yoga e Maternidade, she integrates her expertise in prenatal and postnatal yoga, pilates also, and also children's yoga. Inspired by nature's rhythms, she advocates for conscious pregnancy, supporting women in harmonizing with life's natural cycles. Here is our impressive Susana. You have the floor.
Thank you so much, Laura. Happy World Pregnancy Day to everyone. It's wonderful to be with you and in this wonderful gathering. I'm going to share my screen with you. Okay, wonderful. So today my talk is based on the research in psychology and maternal health. We're going to talk about trauma, burnout, and healing in maternal health professionals. It's also based in lived experience of professionals who work every day in pregnancy, birth, and postpartum. So throughout this presentation, you will see some of the studies highlighted on the slides. And by healthcare professionals, I mean everyone who works in these fields caring for mothers, babies, and families. We usually talk a lot about mothers, babies, families, but I wanted to do a little bit of research on what is going on with the professionals. So because we are going to talk about trauma, I want to acknowledge that if any of the things that I'm going to talk about activates you, please do pause, relax. Your well-being should always come first. So why professionals' well-being matters? Because maternal health care is really one of the most emotional, intense fields in medicine. Professionals regularly witness moments of vulnerability, of fear, of course, also joy, also happiness, but moments also of pain and crisis. So here is a wonderful initiative from the Royal of College Midwives. And they do these wonderful cakes every time that is Midwives Day, and they hold a contest. So here we see some playful imaginary, and we know that research in trauma and neuroscience shows that sometimes these highly stressful environments remain in our nervous system long after the situation has ended, and over time this can shape how professionals feel about their work, the decisions that they make, their presence, and how they show up for families. So well-being of these professionals is not only about taking care of mother and baby, it's also about taking care of themselves, because they shape the environment in which babies are born. So although these are wonderful initiatives, sometimes these things don't happen exactly the way that we expected. And on my research, I found an executive director of a hospital where this initiative was not being held in the way that she thought. And she actually stopped the initiative because she wanted to highlight what was going on here. So I'm going to show other images. So for instance, in these cakes, which are not from the Midwife College, it's images that I found also. And this was done in hospital settings, and this reflects unprocessed trauma that can sit unconsciously. It's trauma that it's tolerated, is minimized, is rationalized as normal. So supporting these maternity professionals, whether in hospital settings, birth centers, or at home, is really about prevention. So why practitioner well-being matters for early development? Because the calmer and more regulated the caregiver is, the safer and more attuned and more supportive the environment becomes for both mother and baby. Pregnancy and birth take place within a field of interactions. The mother's nervous system, the baby's developing nervous system, and the nervous system of the professional that is present. And human beings are profoundly co-regulating beings. Our nervous system don't function in isolation. They develop and regulate in relationship with others. Researchers have shown that our bodies use social cues, like the tone of our voices, our facial expression, our eye contact, to sense the safety and the connection. And regulation isn't only about something that happens inside of us. It's something we co-regulate with each other. Our nervous system constantly communicates, as I was saying, also through posture, our pace of movement, if we are rushing or if we are slowing it down, and through our emotional presence. The signals influence whether another person's nervous system moves towards safety or towards threat. And for a woman during pregnancy, in labor, the emotional environment around her can deeply shape her experience. She may feel more sensitive, of course, but also more vulnerable, sometimes powerful, and sometimes more calm or even afraid. And for a baby entering in the world, the emotional state of the mother during pregnancy, birth, and the early postpartum becomes part of their first physiological and relational experience. So what is considered a traumatic event? In psychology and psychiatry, a traumatic event involves actual or threatened death, serious injury, or sexual violence. It can happen directly by witnessing, learning about it, that happened to someone close, or through repeated exposure, like on professional work. Examples include, for instance, in combat, in the military, assault, natural disasters, accidents, or the sudden loss of a loved one. And at first glance, when we look at all of this, it seems very far from maternal health care. But trauma isn't defined only by the event. It's about how a person experiences it, especially when they feel overwhelmed, powerless, or trapped. In maternity care, both mothers and professionals can face moments of intense fear, of loss of control. And sometimes decisions must be made quickly. Emotions run deep, and hierarchies in hospitals or in clinics can make it hard for professionals to act as if they feel it's right. And that sense of powerlessness is a key driver for traumatic stress. For example, research made by Cheryl Back on traumatic birth experiences show that some women describe their experiences using very strong language. For instance, I felt abandoned and alone, betrayed, raped. My dignity was taken from me. I was treated like nothing, terrified to my core. And this type of testimonials are very, very similar to sexual violation testimonials, particularly when procedures are performed without consent, communication, or respect for bodily autonomy. And these descriptions do not mean that birth is the same as sexual assault in the legal sense, but they highlight that the subjective experience of loss of control, invasion of the body, and lack of consent can be deeply traumatic. So, what can be a traumatic pregnancy or birth for professionals? It isn't only about the dramatic medical emergencies. Trauma can arise whenever the situation feels threatening, overwhelming, or out of control. So here I have a few examples like life-threatening medical events, threats to the baby's life, profound emotional distress, for instance, for a mother experiencing extreme fear and panic or during pregnancy loss of control or moral distress. Professional may feel required to follow interventions that feel unethical and difficult, or feeling unable to provide the care that they feel that the mother's needs. I remember a midwife telling me, I felt like I failed that mother and that baby. So, and witnessing disrespect or violations like obstetric violence or compromising a mother's autonomy and dignity. So, maternal health care is unique. It combines high clinical responsibility with intense emotional environments, while navigating systemic pressures, ethical dilemmas, and hierarchical constraints. Of course, we all would wish that this didn't happen, but it is real and it still happens. Trauma in this field rarely comes from a single traumatic event. It often builds over time through repeated exposure to intense experiences, while professionals must stay composed, supportive in the face of suffering or emergencies. That's why I put these two masks here. A nurse reported, "I had just left from the room after witnessing a traumatic birth and was immediately pulled into another birth room. It was one of the worst days of my life, and I was expected to just keep on going." So the human nervous system isn't a machine, it records experience. So understanding the different forms of trauma is really important. It's a step in protecting professionals by recognizing these different patterns. So here we have the secondary traumatic stress. This happens when professionals repeatedly witness the trauma of others. In maternal health care, it might be emergency interventions, severe complications, or intense paternal distress. Even a single moment, a single event can have reflections and can become a secondary traumatic stress event. Although professionals aren't directly harmed, their nervous system absorbs this experience, and over time, this can show up as intrusive memories, heightened repetitive hypervigilance, or difficulty in switching off after work. There was a very interesting study, and this research shown that 35% of labor and delivery nurses reported moderate to severe levels of secondary traumatic stress, and this was done in the United States. Another type of trauma. So the testimonies here are a nurse that says, "Whenever I heard a patient screaming, I flashed back. I will never get those sounds image out of my head." Another nurse said, "I've never felt so powerless, helpless, or useless in my life." And these are very strong statements. Another type of trauma is compassion fatigue, which, unlike the secondary trauma, it develops gradually. It's the cost of caring when constant emotional support depletes a professional resources. So in maternal health care, professionals offer deep empathy during moments of extreme vulnerability. And without enough time to recover, to repair, they may start feeling drained, detached, or less able to connect with patients. And this isn't a lack of compassion, it's compassion that has been stretched, totally stretched, without restoration, without repair. Another testimony: "Each traumatic birth adds another scar to my soul." Let's talk about another type of trauma, which is moral injury. It happens when professionals are forced to act or remain silent against their ethical values. In maternal health care, this might arise from institutional constraints, lack of resources, time pressure, or rigid protocols that prevent caregivers from providing the care they know is right. And the result is deep internal conflict, guilt, frustration, anger, or feeling helpless. And this concept is very interesting because it was first studied on the military context, and it's now recognized in healthcare. It may occur when professionals witness rough treatment, lack of consent, or obstetric violence, but cannot intervene. And it's very interesting also that we see that there are more nurses suffering from this than actually the physicians. And this is likely reflects their closer continuous contact with patients and repeated exposure to ethnically challenging situations without the authority to act. So other testimonies I had, and a midwife said, "I felt like an accomplice to a crime." Another nurse said, "I felt like I was watching a rape." And again, this is very hard words, and these statements reflect the moral distress and ethical dilemmas that they were facing. Now, burnout is it's different from trauma because it builds slowly, fueled by chronic workplace stress. That's usually when we talk about burnout is about workplace. High workload, staffing shortages, and organizational pressures create these conditions. Signs of burnout can be emotional exhaustion, detachment, reduced effectiveness, questioning one's role. Some of the nurses and midwives were even asking what they were doing there. So it's not a personal failure. It signals that the system has asked more from the nervous system of the individual that it can sustainably handle. So there was a systematic review from 2021 that shown why burnout happened, and these were some of the results: insufficient staffing, unsupporting work environments, excessive workload, and also work and family pressure due to schedules. I would like also to talk a little bit about transgeneration and systemic trauma, because sometimes the work that we choose carry echoes of stories that began long before us. And unprocessed trauma can ripple through families and even shape professional paths. So imagine these stories that sometimes we hear about. There was this grandmother who was a midwife, and then the father is an obstetrician, and then the daughter became also something on the field. And of course, these are positive values and beliefs that were passed. But even an unresolved experience around birth and caregiving can quickly influence and quietly influence what draw us to maternal health care. And this isn't about repeating trauma. Often it's about an unconscious hope to bring healing. When we become aware of these patterns, we can interrupt old cycles and approach our work with greater clarity and presence. And research in epigenetics, we know, also suggests that stress and trauma can leave biological traces across generations, shaping how people respond to stress. So, for our professionals, maternal health professionals, what can we reflect about this? What truly drawn us to this work? How do our own histories shape the way we respond to stress, to vulnerability, to the intensity of pregnancy and birth? And how can we use awareness to stay present and regulated while supporting others? When we understand how these patterns show up, we can learn to regulate our nervous system. We show up differently into the spaces where care happens. So how professional stress affects care? Prolonged stress changes how we show up at work. Professionals may notice reduced patience, difficulty in staying present, quicker reactive responses, emotional withdrawal. I remember a nurse that said, I just wanted to control the environment because I felt so bad about the experience that I had that I didn't want to feel that way again. So she was influencing the treatment of that mother and the baby because of the experience she endured. And of course, the body remembers. Stress and trauma aren't just mental. It's not just about rationalizing it and talking about it. The trauma lives in the body. Even when a difficult event is over, the nervous system can react as if it was still in danger. And professionals may notice muscle tension, muscle sleep problems, fatigue, headaches, or digestive issues, and difficulty in relaxing. So these are not simple signs of I'm tired. These are signals that nervous system is still carrying unresolved activation. And I must say that in a lot of places, there's still a culture that it comes with the job. It doesn't come with the job. Trauma is not normal. Okay. So I remember some of those reports as well. So the good news is that this trauma cycle can also be interrupted. There are protective factors, ways to stay resilient, remain present with mothers and babies, and continue providing high quality care. And research shows that these factors can make a real difference in professional well-being. So one of those protective factors is psychological resilience, our ability to adapt, to recover, and even grow when faced with stress and challenges. And studies shows that midwives with higher resilience experience less burnout and handle occupational stress more effectively. Resilience helps buffer the negative effects of the intense and often unpredictable work in maternal health care. Another protective factor, compassion, satisfaction, the sense of fulfillment and meaning we get from helping others. And research shows that when professionals find purpose and joy in their work, they experience less exhaustion, disengagement, and stress. And it actually protects them against compassion fatigue and burnout. Good leadership and continuity of care models. This isn't just about policy, it's about having organized, supportive environments and leaders who provide guidance and stability. Research shows that midwives working in workplaces with strong leadership and consistent care models report lower emotional exhaustion and better overall well being. Even small practical supports like organized resources, having shelves that are really organized and optimized, having clear systems make a meaningful difference. Social support and team climate, having colleagues that we can rely on, open communication, and a culture of respect and understanding makes a big difference. Research in neonatal care shows that professionals who feel supported by their teams and experience a positive work climate report lower burnout and less secondary traumatic stress. Support systems and institutional interventions. We are talking about formal structures such as peer support, a reflective practice groups, supervision, or access to counseling. I remember one of the executives of a hospital saying that they know that the 24 to 72 hours after an intense experience are particularly important to repair, to process, to integrate what the experience that they've just had. So they knew where they could go. But this was a leader that was informed about trauma. So she was doing real changes in the setting where she was. So the nervous system is remarkable. It can recover and regulate itself, but resilience isn't about being perfect. It's practice. Simple daily actions can, make a big difference. Slow conscious breathing, grounding in the body, taking small pauses between tasks, or simply noticing your surroundings and allowing yourself to feel safe. Even small moments like this can help these professionals to feel present and more positive over time. And of course, I needed to come back to my somatic practices here, such as yoga, tai chi, qigong, certain martial arts. So these are languages that integrate body and mind, even tapping. We need to invest in a culture of care. Ultimately, protecting the well-being of maternal healthcare professionals is not only an individual responsibility, it is also a systematic one. It means acknowledging the emotional impact of their work, to create spaces for reflection and support, to recognize that the well-being of professionals is an essential part of the quality of care. When caregivers are supported, something really important happens. Professionals are more able to offer presence instead of urgency, listening instead of rushing, and safety instead of tension. So the result are professionals that can be present and can do the work that they do with a positive attitude and also create a positive environment for those mothers, babies, fathers, and their families. Thank you.
Well, thank you. Thank you, Susana, for daring approach such a horrendous theme and so important, so vital. Look, we have here Maura from Pretoria in South Africa. She says, and she voices what we all are thinking, wow, this is what I yearned to hear. Very insightful. For the first time, attention is also given to healthcare workers. Thank you, Susana. That's what she wrote. And Aneshe from Turkey. This is exactly why I started to work as a birth psychotherapist for not only families, also for birth teams in Turkey. And Olga from Greece, she has a question. As health professionals are frontliners and their own prenatal and perinatal trauma is triggered with every childbirth, it is high time we organized services for the vocational trauma you're talking about. And do you happen to know if such services are present globally and in which countries and what their experience has been so far? Peer-to-peer groups, of course, seem to offer a little bit of comfort, but they are skin deep and inadequate.
Yeah. Now we are talking about models. We are talking about continuing care, midwifery care. Not now. This has been, in the field for many years. But it is becoming more and more aware. Also, trauma-informed care. But I would say that this is not global at all. And I can also say that this type of traumas that I was just saying, that I was just talking about, it's relatively new. This is a new awareness that is coming in the field. For instance, some of the names of the trauma weren't not even it didn't even exist, right? And it is that's why I thought that this was so important to bring up in Prenatal Alliance, because these researchers are doing such an amazing work in showing that this 35% having secondary trauma, it's not 1%, it's not 2%, it's a lot. And that means that the investments that governments are doing, that health departments are doing, are not enough. Maybe we need to support more the professionals in the way that they are showing up at work. Because we think a lot about mothers and babies, but one of the things that I wanted to make sure with the work that we do at Prenatal Alliance is that what we do really has relevance on how women and babies are taken care of. And we cannot forget the professionals. So this is part of the work that we are now engaging.
No, this is fabulous to see somebody stripped away from her dignity. It is traumatic, not just for the person, and it's anti-constitutional. I know that lawyers in Brazil are going after that. You cannot do it. It's against the constitution to strip away human dignity from somebody. And women in labor are often with that.
François, and let me just say one more thing. It is not only on the hospital setting, on the clinic setting, okay? This also affects doulas, therapists, okay? Yeah. People that do birth at home. I had a doula telling me, after what I endure, I don't want to do it anymore. I don't want to be a doula anymore because of a traumatic experience. And they are so needed. They are so needed. They should do such a wonderful work. So we need to have places where they can go when these things happen.
Yes, and then we have François Amig who says, Susana, how to evolve from this dehumanized system?
Barbara Harper gave a wonderful talk, and she said we do it from the inside. And I do believe that. I do believe that if we start talking about fighting the system, we won't get there. It's through awareness, it's through consciousness, it's through the work that we are doing at Prenatal Alliance, spreading the knowledge, that we can change the system from the inside. It's bit by bit, one person, that can change what we are dealing with. And I think that is possible. We are seeing that is possible.
Yeah, and from Japan, we have Yuko, who asks, if we were to truly center the well-being of caregivers within maternal healthcare systems, what might need to change at a structural level, Susana?
I remember Kate White talking with this executive director of the hospital, and she was saying, just one leader that are conscious, that it's aware of these issues, can change the whole structure. the whole setting of the hospital, the whole feeling of the professional. So we need good leaders also.